The primary focus is, of course, going to be on the balanced meal, and it all boils down to that. As healthy eating not only is important for good health, but we also have to make sure that the people do enjoy or retain the joy of eating. We need to understand carbohydrates better. Let me put it that way. Everybody seems to say that eat less carbohydrates, but it is not about only eating less carbohydrate, it's also about eating the right type of carbohydrates. By saying so, I would mention two things. One is, whatever carbohydrate that you want to include, or a staple that you want to include, make sure it's not refined, make sure that it has good amount of fiber, and if possible, look at the protein content of the cereals, and the higher the protein content of the cereal, the better it is for you. So 70 to 60 to 70% of our total energy does come from carbohydrates, and we cannot avoid that, or totally take that off our diet. But where are we getting it from is what is important. So if you're getting it from sweets, chocolates, mithai, then that's bad. If you're getting it from soft drinks, sweetened beverages, colas, that's bad. And therefore we need to replace all these liquids or drinks that we are having with the healthier options of either buttermilk, jaljeera, sugarcane juice, which are more natural and more healthy in our diet. When we look at the carbohydrate source, we are eating breads, chapatis, rotis, etc., and try and, as I said, keep it as less processed as possible, and try and include different grains in our diet. We think our traditional staple is rice, or we think our traditional staple is chapati, but if you go 60 to 70 years back into the history, you will see that they were having a totally different locally grown grain. And today the science is taking us back to those grains, in terms of using millets, or in terms of using oats and stuff like that, which was very bran filled, which was very fiber filled, locally grown, uh, unmilled or unprocessed grain. And that's what we should be looking for in our search for our right type of staple that we want to include in our diet. We also now coming The next macronutrient that we are coming to is certainly the protein. This is one of the biggest nutrient that needs to take center stage, both in terms of what we are discussing, both in terms of what we are eating on a day to day basis. And that's why the poll question came in there, because all of us need to focus on the protein intake. Now, why are we discussing? Because in India in general, protein intakes are low, where we need to eat at least 1 gram per kg, amounting to 60-70 grams. We are at 50% of that. We are at 30-35 grams of protein. We did one study in our hospital and looked at two groups of patients, all diabetics, and wanted to look at their sugar levels. But one of the observation is, if you calculate their total daily intake of protein, it was coming up to 35 grams. So a diabetic eating only 35 grams of protein means he's eating 50% less. So obviously he's filling himself either with fat or carbohydrate, and then we need to see what kind of carbohydrate. And all of this will have an impact on their sugar levels. So coming back to the relevance and importance of protein, protein helps all the antibody molecules, the enzymes that we have, the cells that are produced, the immune building molecules that are there, the muscle, which is a primary source, which is a reflection of our strength, all of which needs protein as a source of food. And therefore we need to see that a combination, usually I feel that neither a pure vegetarian, a vegetarian will have to really look at their protein intake. But even if you are not a staunch non-vegetarian and you do a combination of vegetarian non-vegetarian diet, you have both variety and the quantity and quality of protein that you're looking for. So if one needs to do a quick assessment of the protein intake, look at whether the person is having milk or curd in the diet, dals every day, every both the meals, whether eggs are there about 3 to 4 times a week, non-veg is there once or twice a week, whether they have healthy eating habits in terms of including pulses in their diet, whether it is moong, chole, rajma. Are you buying pulses at all in the diet? Is there any form of pulse that is cooked through the week? Are you sprouting it at least occasionally? These are the questions that we can ask our patients and get a perspective about their protein intake. And once we ask these questions, they're of course going to be far more conscious about what they are going to be eating. Fats, I'm not going to discuss greatly about fats because all of you know. But one of the most important thing with regards to fat is, the anti-inflammatory property of the omega-3 fatty acids. So we have to guide patients to eat a lot of omega-3 rich foods, whether it is coming from fish, it is coming from walnuts, it is coming from other nuts and seeds like sesame seeds, pumpkin seeds, chia, etc. All of these should be incorporated in the diet in some form or the another. I see that seeds like watermelon and pumpkin can actually be used for cooking. The almonds can be used for cooking. Nuts like pistachios can be incorporated in a lot of bakery products. So let us figure out how to include this in a masked form in our diet so that acceptability levels are much higher instead of only wanting people to snack on nuts all the time. This is just an example of how 400 calories can be brought from a big bag of chips, and 400 calories can equally be had from a big balanced thali. And if we can bring this information out there to our patients, they will then understand that the nutrient diversity comes from a well balanced meal rather than only calorie counting from different kinds of foods. Decrease stress, because stress adds to ulcers, acidity, GERD, long term colitis, can contribute to irritable bowel. Uh, Most often, complications of stress are gastritis, heartburn, and peptic ulcers. And most commonly, the reasons are not anything very big, but just simple things like skipping meals, excessive consumption of tea, coffee, beverages, or alcohol, long, very, very long gaps between meals, eating very spicy food and pickles, alcohol consumption, cigarette consumption. We also have one category of infection, which is the H. pylori infection, which can be very well taken care by the medication given. And therefore, the whole outlook should be, eating for good health. And if we have not already moved that way, we need to urge each and our patient to kind of look at it, especially if they have been post COVID. We see that a lot of post COVID patients have lost tremendous amount of muscle. They have they are also complaining about knee pain, bone pain, and general feeling of fatigue and tiredness, which is continuing into several months. So, what I've seen is those who have really refocused on their diet, even though we have been affected with COVID, relook at their diet, increase their protein intake, figure out what foods that they need to include in their diet, looked at their calcium intake, and also corrected their multivitamin intake. They have recovered faster and they're complaining less and less about the weakness. But they've just not looked at muscle loss, lean body mass loss. They are the ones who continue to feel weak and continue to feel that their bones are hurting because there's not enough muscle to support them while they're doing exerted physical activity.